This is the final section of Chapter 1 on the introduction into what biomedical engineering is. In the previous lecture, we looked at the history of biomedical engineering, as it is a very developing field that only really came about in the last 40 years. We talked about how the advancements in healthcare and the basic sciences helped create biomedical engineering, and that the development of the new healthcare systems helps create the community that's responsible for the collaborative environment within biomedical engineering. In this lecture, we're going to be looking at the applications of biomedical engineering. I'm going to give you just a general graphic of what the many different types of biomedical engineering aspects are, and I'll go into small details on what each of them do and how they're responsible and relate back to the field of biomedical engineering. So as you can see, biomedical engineers are involved with a wide variety of interdisciplinary activities. There's so much potential and application within biomedical engineering that you can really go anywhere with it. I'm going to talk about everything that's on this slide, and I know it seems like a little bit, but as you can see, they all tie into that general idea of biomedical engineering. And since this is an introductory course, I want to make sure you understand the full potential of what this topic can hold. I'll start at the top and go in a clockwise motion so you can have a better understanding of which of the next things I'll be talking about. To start off with biomechanics. Biomechanics is a study on how things move. You can use biomechanics in order to understand how a muscle will move, how a joint system is going to move in what direction, how much load strain is going to be affected onto it, how much force it needs to hold in order for it to be effective within its area. And that's just the tip of the iceberg of what biomechanics does. It's really involved with human movement and understanding how much force and resistance is necessary for something to be applicable and effective in that situation. Going on to the next thing, prosthetic devices and artificial organs. Biomechanics actually plays a role within this section because you're mainly looking at how these devices and organs are going to fit in within the body, and if they can, then how are they going to interact with that environment, and if they have enough power and durability with them to withstand certain types of forces and other types of interactions. But prosthetic devices and artificial organs are mainly to replace certain functions within the body. If you have a prosthetic arm, you want it to be effective and you want to still have control over a hand, and an artificial organ, you want it to ensure that it does have the same functions and capabilities. For example, an artificial heart, you want it to be able to pump blood effectively in the same type of blood pulse that you would expect in a normal heart, with the acceleration and deceleration when you're in high stress or low stress environments, as well as other types of things, including it being biocompatible or not having any sort of negative impact and relationships with the external environment in your body. For medical imaging, you're primarily looking to use x-rays, PET scans, CT scans to make sure that you can accurately see within the body and look in and see the different types of organs and body parts to ensure that the body is safe and healthy. Not only that, but you want to transfer the information in a way that's readable, effective, and easy to understand to both the doctor and the patient so that everyone can understand what's going on. Biomaterials looks at the materials that are being used, particularly for prosthetic devices and organs, not only to help create new biomaterials that will be more effective than the ones we have, but to figure out which ones are more applicable in different circumstances. You don't want to have something like a ceramic, which is easily shatterable, for something that needs to be very bendable. However, you don't want to have something that's very inert if it needs to interact with the environment. And these are things that need to be taken in when researching biomaterials. For biotechnology, you're trying to create different technological-based biomaterials and bio-related items, such as medicine, other types of syringes, and things within that field in order to have it be effective and helpful for the patients that are being treated with it. Tissue engineering focuses on helping tissues regenerate, for tissues to become stronger, and for tissues to be held together if they are in a place where they are torn apart. Neural engineering is the same thing except with neural networks so that your brain can communicate effectively with the rest of your body. Biomedical instrumentation is focusing on the instrumentation, particularly revolving around medical imaging. You want to create instruments that are effective and useful for everyone involved, because you don't want to create a good machine if it can't produce good output. Vice versa, you don't want to have something that is very good at creating output but is very difficult to use, and finding that medium between the two. Bio-nanotechnology is actually one of the most up-and-coming fields out of everything that's being talked about, because nanotechnology is something that's very, very new. But creating small little robots or devices that can fit within the body to help treat, preserve, and enhance the health of a patient is very essential within the field of new biomedical engineering. Physiological modeling is also an aspect of biomedical engineering, where you're looking at the overall patient's health and their blood networks and all their other organ systems that can help make sure that they're safe, healthy, and being able to understand what's going on. By doing physiological modeling, we can render and create new models to have new meaning into the way that we study, look, and understand the physiology of our patients. Rehabilitation engineering is more focused on helping people who need to rehabilitate from an accident that would require physical strengthening and building up of the body again, and understanding what exactly needs to be built up. Working with physiotherapists is also very essential in this area, so there's a lot of room for collaboration. Medical and bioinformatics is more focusing on the logistics side of doctors and helping being able to compile, store, and understand the information that is looked at and gotten from patients. Clinical engineering is very similar to that, but creating more effective environments within clinics and surgical areas. And the penultimate one is biosensors, creating sensors that can focus and understand different health concerns and aspects of a person's health, such as heart rate monitors, oxygen saturation, glucose measurement, and other types of sensors that can look into the body and determine health. Lastly, medical and biological analysis, similar to that of biosensors, but just further analysis into the body and understanding what the patient is going through and what they're looking at. I know this is a lot of what can be applied within biomedical engineering, but you need to see that there's so much potential and understanding within this field, and the possibilities are almost limitless, even though it's just within healthcare. However, there's much to look into, and there's almost every type of interest that is available if you want to be interested in healthcare can be available here. So there's so much going on, and we'll get into these things, each of them, as the lesson progresses. The next section of this course is going to be over physiology, to give you a better understanding of how the human body works and what is being worked with within biomedical engineering.